Hi, I'm Styx with Empire Surgical, and this video will be the anatomy of the shoulder. I'm going to do it like I did last week. Bones, then ligaments, and then tendons. So there's three bones of note, first of which is the humerus. That's commonly known as the upper arm, and that's the end of which is going to be the humeral head, which is going to be the ball for the ball and socket joint of the shoulder. There's also a ridge on the top of the humerus, known as the greater tuberosity. Another ridge known as the lesser tuberosity, which is going to be more anteriorly located. There's a spot between the two, the intertubercular groove, which will come into play later as well. The top of the humerus, known as the humeral head, the ball, is going to be covered in articular cartilage. This cartilage is going to act as a lubricant. It's going to help to make smooth movements when the shoulder is rotated. Second bone, scapula, commonly known as posteriorly the shoulder blade. But there's three other parts of it that are important here. There's the acromion, which is going to be located posteriorly and superiorly to the joint space. On the anterior side, there's the coracoid, and then of course there's the glenoid. Now the glenoid is going to be the face or the socket for the ball and socket joint. But when you're talking about a ball and socket joint, you don't want bone on bone. So the glenoid is actually going to be covered in a cartilaginous tissue known as the labrum. And the labrum is going to act as sort of a cushion to get between the two bones. It's also going to deepen the pocket that the humeral head sits in, and it's going to act to really stabilize the whole joint. Third bone is the clavicle. Clavicle is going to extend laterally almost by the acromion, extend medially, and it's going to connect up the rest of the skeleton of the torso. So those are the three bones. Moving on to the ligaments. There's 6 ligaments of note here, and they're all pretty aptly named. They pretty much explain which bones they attach to. So first we have the acromioclavicular ligament. That's going to extend from the acromion to the clavicle. And we have the coracoclavicular ligament, which extends from the coracoid to the clavicle. And lastly we have the coracoacromial ligament, which will extend from the coracoid posteriorly to the acromion. So those three are going to really make up sort of the upper part of the scapula and tie that region to the clavicle. There's 3 others. As I said, there are 6, and they are known as the glenohumeral ligaments, the inferior, middle, and then the superior glenohumeral ligaments. They obviously attach the glenoid to the humerus. Moving on to tendons. There are 5 tendons that we're concerned with here, 4 of which collectively constitute what's known as the rotator cuff. Each of these tendons is named after the muscle from which it attaches to. So we first have the subscapularis, which is going to extend from that lesser tuberosity on the humerus that I mentioned, medially across to the subscapularis muscles. The most superiorly located tendon is the supraspinatus. That's going to extend from the greater tuberosity medially over the humeral head into the supraspinatus muscles. Moving posteriorly from there, we have the infraspinatus, again, anchors at the greater tuberosity over the humeral head to the infraspinatus muscle. And lastly, there's the teres minor, which is going to be most posteriorly located, extending from the humerus medially into the teres minor muscles. So those 4 collectively are what's known as the rotator cuff. We also have one more, the biceps tendon. The biceps tendon is going to extend actually from the top of the labrum. It's going to go through that intertubercular groove that we mentioned, which is right between the greater and lesser tuberosity. And it's going to extend along the length of the humerus into the biceps muscle. All of those collectively form the basic elements of the shoulder. When put together, they allow for a great range of rotation. I'm Styx with Empire Surgical. Thanks for watching. All feedback's appreciated. Have a great weekend.